Shalom. My name is Dr. Michael Band. I'm a consultant clinical psychologist and the clinical director of an NGO called Arbel. And what I'd like to do for a couple of minutes is just explain to you a little bit about Machon Arbel and the work that we're doing at the moment in Israel. Machon Arbel was set up 3 years ago as a group of psychologists, educational and clinical psychologists, dedicated to improving the psychological awareness of the educational system in Israel and different social organizations. That was how we started. However, like many things in Israel, on the 7th of October, on Simchat Torah, everything changed. And Machon Arbel understood that we have a role to play in trying to ease and develop the rehabilitation of the children and the adolescents in the country, in Israel, after the trauma that the whole country had been through. Because of a deep understanding that in the end, the rehabilitation of the whole country is basically reliant on the rehabilitation and the welfare of the children and the adolescents. I'd like to give you 2 examples of our work, which, as I say, changed because of what happened on the 7th of October. One example is actually quite a small example. I personally received a call from the lady in charge of the school counselors in the south of Israel, a call which I received on the 9th of October, a telephone call. And she said the counselors, their role now is critical, but they have gone through such trauma. We're talking about the people in the villages and in the towns and in the kibbutzim and the moshavim around Gaza who had received the major blow of the 7th of October. And now these school counselors, even though they've been through enormous trauma themselves, were needed to start the rehabilitation of the children in the schools. But these school counselors themselves were falling apart in the most obvious and understandable way. And we tried to think what Machon Arbel can do in order to help this situation. And the understanding that we came to is that we need, first and foremost, to support the supporters, which meant that these school counselors who were critical in the rehab process had to feel that they were supported themselves. And there were 9 of them in all, and we took 9 clinical psychologists from Machon Arbel, and we said to them, your job now is to be the total address of each and every one of these school counselors. Every school counselor had a dedicated clinical psychologist to be able to turn to for whatever reason, whether it's for themselves, for their family, for their work, for their professional abilities, whatever they needed for the coming month. This clinical psychologist was there for them. And we understood that we could set up this process very, very quickly. One of the abilities of Machon Arbel is to respond with speed, which sometimes the bigger systems within a country or within Israel take longer to get going. Within 12 hours, we'd set up this system, and these school counselors had a backing, had support for the work which they needed to do. That's one small example. A much bigger example is the town of Ashkelon. Ashkelon was the largest town which suffered directly from the trauma of Simchat Torah, and the mayor of the town turned to Arbel and said, I understand that the schools are critical in the rehabilitation process after what we've been through, but it's bigger than we can handle. We need some help. So again, relatively quickly, Arbel set up a system whereby all of the schools in the city of in the town of Ashkelon had 4 referents who we trained up in the theory and the practice of dealing with trauma intervention. so that they themselves could teach all the teaching staff in Ashkelon. We created a pyramid system whereby we taught the volunteers taught the staff, and the staff worked with the kids. So in the end, the whole of Ashkelon was covered for trauma intervention, all the schools, and that's a system which has now been looked at by other countries by other towns in the countries, because we realise that this is a way that we can touch base with all the children, because a very deep understanding from the psychologists within the NGO of Arbel is that trauma is very, very common this year in Israel. I can't say that everybody's been through trauma, but a large percentage, and that's normal, it's understandable, and to be honest, it's not the most terrible thing. It's painful, it's harsh, but in the long term, it doesn't particularly worry people like me. What does worry the psychologists and the psychiatrists is a psychological disorder, which I'm sure you've heard of, called PTSD, post-traumatic stress disorder. This is very, very worrying. And our aim is to take the trauma and not let it develop into PTSD. And for that, we need to do relatively quick interventions and to identify the specific subjects, the specific pupils who need therapeutic intervention and not intervention of the school counsellors or the teachers or the educationalists. And throughout the country, we're going into the schools, training up the staff, the school counsellors, the school psychologists, and the teachers themselves in how to identify the problematic children, and the ones who we're less particularly worried about, to give them a feeling that the trauma has been accepted, has been noted, has been taken aware of, and that the children have got an address from their teachers that they can turn to. Those are just two or three small examples of the work we're doing. We appreciate enormously the support, both moral and financial, that we're feeling from all sorts of bodies around the world. And Canada is a very, very strong partner. The Jewish community in Canada, a strong partner in what we're doing. We've got a very close relationship with Harold, who I'm sure everybody knows, and we thank you very, very much for your care, your concern, and your support. The work that we're doing wouldn't happen without the support of people like you, and we thank you from the bottom of our hearts.